Hey guys, this is Dr. Christopher Dose at Chiropractor in Jackson, Tennessee, and with me today I've got Mr. Wade here from Savannah, right? Down in Savannah, Tennessee. So they made the trip up to Jackson. So we're excited to have Mr. Wade here. Now Mr. Wade is dealing with some right-sided hip pain, lower back pain, traveling down the right side of the leg, so kind of like sciatica. How long has that been going on for Mr. Wade?
Probably about a couple years now.
A couple years. So chronic. And that's the thing, most people deal with chronic pain, and you've tried other chiropractic adjustments, and it helped for a little bit, but he specifically came here for the ring dinger technique. So we're very excited to have help Mr. Wade out, and hopefully get some relief. All right, so let's go ahead and check your posture first, all right?
Okay.
So look right there for me, you come over here. So we're gonna have you bend forward and back. Good, come back all the way back. So feel kind of kink up when you go in the back there. Good. Now let's check it from the side here. Now here's his ear and here's his shoulder. So he's got a little forward head translation. Typically where the ear drops down should be where this finger is. So you can see we're a little forward. So he's got a little forward head translation. All right, Mr. Wade, come over here. I'm gonna start you out, lay you on your stomach right here.
Okay.
You can go ahead and just drop your arms down. Okay. There you go. Great. Let's go ahead and check your legs out. Oh, here, I'll let you can just relax them. There you go. So, let's check here. Right one's a little short. Get even. Does that tighten up at all?
Yes, it does.
Gotcha. Tender at all on this right hip?
Yes.
You got some trigger points down here in the lumbar spine. How about up in this mid back?
Not that bad, really.
Not that bad.
Neck is
Right in there. Yeah. All right. So to begin with, we're going to go ahead and adjust your pelvis first. So you're going to feel the table pop up. Like this. Okay, it's going to be a drop. So I'm adjusting the SI joint at a 45-degree angle, and we're going to go from posterior to anterior, right there. So we adjust the joints in their physiological ranges of motion. Now here's the sacrum, straight superior to inferior. And then we're going to work on this other SI joint on a 45-degree angle also. Good deal. Go ahead and keep this leg straight. Raise it as high as you can for me. Drop it. Try this one. Good deal. Drop it. Okay. Got a little work to do, so I'm going to use a little instrument here, Mr. Wade. I feel like a little jackhammer. Lift this left leg for me. There you go. Drop it. Try the left one again. Drop it. One more. Drop it. Good deal. Feel a little bit easier?
Yes.
Yeah. Now, on Mr. Wade's exam, we noticed that he had pretty good reflexes bilaterally. They were normal that as far as the speed on both sides, and nothing else showed up as far as contraindications to receive care. So let's go back and check your feet here. Good. Feel a little looser?
Yes.
Good. Awesome. So now we're gonna adjust L5. Maybe a little tender right here, okay, Mr. Wade? Good. L4. L3. L2. Give me a deep breath. Here's L1 all the way out. Woo! Feel okay?
Yes.
Good. Okay, we're gonna work our way up into the thoracic spine. Deep breath, all the way out. Good deal, man. Okay, right here. Deep breath, all the way out. Awesome. Okay, a little spot right here. Good deal. Does that feel okay?
Yes.
Good. All right, flip over on your back for me.
Okay.
All right, so let this leg just kind of go limp.
Okay.
There you go. Good. Just relax it.
Okay.
There you go. Let it bend right there. Perfect. You'll feel a little tug. Good deal. So this is adjusting the hip joint. Okay, relax. Good deal. Come have you sit up here for me. All right. Swing this way. Mr. Wade's a Notre Dame fan, but we won't hold that against him. Let that drop right there. Okay, let it drop. Awesome. So, Mr. Wade, before you came in here, you were on the Normatec pneumatic compression device. How did that feel?
That was amazing.
Yeah. So before we adjust people, we want to help them get as relaxed as possible because that helps with the adjustment. Relax right there. There we go. And so we use a Normatec pneumatic compression device. Relax. Good. Just to kind of help you relax a little bit. Helps with circulation, healing, and it does decrease some pain. Relax right there. Yeah. Awesome, man. All right, come on over here. So you kind of know how this works?
Yes.
Sit right here and then lay on back. Awesome. So you're just going to let those bend naturally. There you go.
All right.
It's okay. It's got a sensor on it that so it won't smash people's hands. Go ahead and scoot down this way for me. Perfect. Right there, man. Just let it relax. So Mr. Wade's a taller guy, so he's going to be pretty high up there. So this is kind of the worst part of the pins because we got to get you pretty tight. Feel okay?
Mm-hmm.
Alright, so you're just gonna breathe through your nose, keep your teeth together. Give me a deep breath, blow out through your nose, teeth together. Good deal. How far did you feel it?
Oh, all the way down.
Did you?
Mm-hmm.
It's kind of a bigger adjustment, that's for sure. The first one is pretty sore. The second one is a little sore as well, but after that it gets better.
Mm-hmm.
Okay, so just relax. Good deal, man. Awesome. So this is also how you should sleep. On your back, without a pillow, and your legs elevated. Is this how you sleep?
No, definitely not.
I'm gonna sit up here. Awesome. All right, come over here and stand right here for me.
Okay.
Go ahead and bend back. Good. All the way. Good. Good. Look straight for me. Good deal. All right, you can relax, sir.
All right.
All right, stand over here with me.
All right.
Here you go. Right there, that's perfect. All right. So how would you feel after your first time?
It's a little overwhelming with the adjustments, but
Yeah.
I feel a lot better.
Good.
I do.
Awesome.
I really do.
Awesome. And you will be sore, like I said, for 48 to 72 hours. That's very normal. Crushed ice will help. Just put it directly where it hurts.
Okay.
And we are about to go do a laser treatment,
Okay.
which will greatly help with the soreness. So how would you've had other chiropractic adjustments, how would you compare this to what you previously had?
A lot more. It's a lot more in depth.
Yeah.
You know, I mean, you're covering everything,
Yeah.
not just the pain spots.
Absolutely. The exam portion of it, do you think it was adequate?
Yes.
Did you feel like we covered everything?
Yes.
Made sure there weren't any contraindications. This is a very safe adjustment. Chiropractic in general is very safe, but we also, we want to make sure that people don't have things such as tumors, infections, fractures, heart disease, history of stroke, history of heart attacks or atherosclerosis or anything like that, neurological diseases. Do you know of anyone that you think this could help?
Yes, definitely.
Awesome. And again, if you've had surgery, this is perfectly safe as far as like spinal surgery goes, as long as everything is healed properly. But if you had fusions, rods, any sort of that stuff, it's perfectly safe. All right, so if you want to find out more about this, you can call us at 731-736-4200 or go online at chiroplusjackson.com. Thank you.